don't stop. Don't stop. Don't stop. Don't stop.
Kidney and ureter. Introduction. The closely packed structure and numerous functions of the kidney illustrate the beautiful workmanship of our Creator. It not only applies to the kidney but to each and every part of our body. Dissection. Remove the fat and fascia from the anterior surface of left and right kidneys and suprarenal glands. Find left suprarenal vein and left testicular or ovarian vein and trace both to left renal vein. Follow this vein from the left kidney to inferior vena cava and note its tributaries. Displace the vein and expose left renal artery, follow its branches to the left suprarenal gland and ureter. Follow the ureter in abdomen. Identify the structures related to the anterior surface of both the kidneys. Turn the left kidney medially to expose its posterior surface and note the relation of its vessels and the ureter. Identify the muscles, vessels, and nerves which are posterior to the kidneys. Carry out the same dissection on the right side. Note that the right testicular or ovarian and suprarenal veins drain directly into the inferior vena cava. Cut through the convex border of the kidney till the hilus. Look at its interior. Identify the cortex, pyramids and calyces. Follow the ureters in the renal pelvis, in the abdomen, in the pelvic cavity and finally through the wall of urinary bladder. Synonyms. The kidneys are also called renes, from which we have the derivative renal, and nephros, from which we have the terms nephron, nephriphies, etc. Definition. Kidneys are a pair of excretory organs situated on the posterior abdominal wall, one on each side of the vertebral column, behind the peritoneum. They remove waste products of metabolism and excess of water and salts from the blood, and maintain its pH. Location. The kidneys occupy the epigastric, hypochondriac, lumbar, and umbilical regions, Fig 24.1. Vertically they extend from the upper border of 12th thoracic vertebra to the center of the body of 3rd lumbar vertebra. The right kidney is slightly lower than the left, and the left kidney is a little nearer to the median plane than the right. The transpyloric plane passes through the upper part of the hilus of the right kidney, and through the lower part of the hilus O1 the left kidney. Shape, size, weight, and orientation. Each kidney is about 11 cm long, 6 cm broad, and 3 cm thick. The left kidney is a little longer and narrower than the right kidney. On an average the kidney weighs 150 g in males and 135 g in females. The kidneys are reddish-brown in color. The long axis of the kidney is directed downwards and laterally, so that the upper poles are nearer to the median plane than the lower poles, Fig 24.2. The transverse axis is directed laterally and backwards. In the foetus the kidney is lobulated and is made up of about 12 lobules. After birth the lobules gradually fuse, so that in adults the kidney is uniformly smooth. However, the evidence of fetal lobulation may persist. External features. Each kidney is bean-shaped. It has upper and lower poles, medial and lateral borders, and anterior and posterior surfaces. 2 poles of the kidney. The upper pole is broad and is in close contact with the corresponding suprarenal gland. The lower pole is pointed. 2 surfaces. The anterior surface is said to be irregular and the posterior surface flat, but it is often difficult to recognize the anterior and posterior aspects of the kidney by looking at the surfaces. The proper way to do this is to examine the structures present in the hilum as described below. 2 borders. The lateral border is convex. The medial border is concave. Its middle part shows a depression, the hilus, or hilum. Hilum. The following structures are seen in the hilum from anterior to posterior side. The following structures are seen in the hilum from anterior to posterior side. The renal vein, 1. The renal artery. 2. The renal pelvis, which is the expanded upper end of the ureter. Examination of these structures enables the anterior and posterior aspects of the kidney to be distinguished from each other. As the pelvis is continuous inferiorly with the ureter, the superior and inferior poles of the kidney can also be distinguished by examining the hilum. So it is possible to determine the side to which a kidney belongs by examining the structures in the hilum. Commonly, one of the branches of the renal artery enters the hilus behind the renal pelvis, and a tributary of the renal vein may be found in the same plane. Relations of the kidneys. The kidneys are retroperitoneal organs and are only partly covered by peritoneum anteriorly. Relations common to the two kidneys. 1. The upper pole of each kidney is related to the corresponding suprarenal gland. The lower poles lie about 2.5 centimeters above the iliac crests. 2. The medial border of each kidney is related to a. the suprarenal gland above the hilus and to the ureter below the hilus. 3. Posterior relations. The posterior surfaces of both kidneys are related to the diaphragm. Medial and lateral arcuate ligaments. A. Psoas major. B. Quadratus lumborum. C. Transversus abdominis. D. Subcostal vessels. A. Subcostal, iliohypogastric, and ilioinguinal nerves. B. In addition, the right kidney is related to 12th rib and the left kidney to the 11th ribs. 4. The structures related to the hilum have been described earlier. Other relations of the right kidney. Anterior relations. 1. Right suprarenal gland. 2. Liver. 3. Second part of duodenum. 4. Hepatic flexure of colon. 5. Small intestine. Out of these, the hepatic and intestinal surfaces are covered by peritoneum. The lateral border of the right kidney is related to the right lobe of the liver and to the hepatic flexure of the colon, Fig 24.3. Other relations of the left kidney. 1. Left suprarenal gland. Spleen. Stomach. Pancreas. Splenic vessels. Splenic flexure and descending colon and jejunum. Out of these, the gastric, splenic, and jejunal surfaces are covered by peritoneum. The lateral border of the left kidney is related to the spleen and to the descending colon. Capsules or coverings of kidney. The fibrous capsule. This is a thin membrane which closely invests the kidney and lines the renal sinus. Normally it can be easily stripped off from the kidney, but in certain diseases it becomes adherent and cannot be stripped. Perirenal or perinephric fat. This is a layer of adipose tissue lying outside the fibrous capsule. It is thickest at the borders of the kidney and fills up the extra space in the renal sinus. Renal fascia. The perirenal fascia was originally described as being made up of two separate layers. Posterior layer was called fascia of Zuckerkanal and anterior layer called fascia of Gerota. These two fasciae fused laterally to form lateral conal fascia. According to this view, lateral conal fascia continued anterolaterally behind colon to blend with parietal peritoneum. But lately it has been researched that the fascia is not made up of fused fasciae, but of a single multilaminated structure which is fused posteromedially with muscular fasciae of psoas major and quadratus lumborum muscles. The fascia then extends anteromedially behind the kidney as bilaminated sheet, which divides at a variable point into thin layer which courses around the front of kidney as anterior perirenal fascia and a thicker posterior layer which continues anterolaterally as the lateral conal fascia. It was believed earlier that above the suprarenal gland the anterior and posterior perirenal fasciae fuse with each other and then get fused to the diaphragmatic fascia, but research presently demonstrates that superior aspect of perirenal space is open and is in continuity to the bare area of liver on the right side and with subphrenic extraperitoneal space on the left side. On the right side at the level of upper pole of kidney, anterior fascia blends with inferior coronary layer and bare area of liver. On the left side, anterior layer fuses with gastrophrenic ligament. Posterior layer on both right and left sides fuses with fasciae of muscles of posterior abdominal wall, i.e. psoas major and quadratus lumborum, as well as with fascia on the interior aspect of thoraco-abdominal diaphragm. Medially the anterior layer is continuous from one to the other kidney and the posterior layer is attached either side of vertebra. Below both the layer extend along the ureter and fuse with iliac fascia. Pororenal or poronephric body, fat. It consists of a variable amount of fat lying outside the renal fascia. It is more abundant posteriorly and towards the lower pole of the kidney. It fills up the paravertebral gutter and forms a cushion for the kidney. Structure. Naked eye examination of a coronal section of the kidney shows, 1. An outer reddish-brown cortex. 2. An pale medulla. 3. A space the renal sinus. The renal medulla is made up of about 10 conical masses, called the renal pyramids. Their apices form the renal papillae which indent the minor calyces. The renal cortex is divisible into two parts, A. Cortical arches or cortical lobules, which form caps over the bases of the pyramids. B. Renal columns, which dip in between the pyramids. Each pyramid along with the overlying cortical arch forms a lobe of the kidney. The radial signs is a space that extend into the kidney from the hilus. It contains, 1. Branches from the renal artery. Tributaries of the renal vein. A. The renal pelvis. The pelvis divides into 2 to 3 major calyces, and these in their turn divide into 7 to 13 minor calyces. Each minor calyx equals cup of a flower, ends in an expansion which is indented by 1 to 3 renal papillae. Structure of uriniferous tubule. Each kidney is composed of 1 to 3 million uriniferous tubules. Each tubule consists of two parts which are embryologically distinct from each other. These are as follows. The excretory part, called the nephron, which elaborates urine. Nephron is the functional unit of the kidney, and comprises, a renal corpuscle of Malpighian corpuscle, for filtration of substances from the plasma, made up of glomerulus, Latin hell, a tuft of capillaries and Bowman's capsule. B. Renal tubule, for selective resorption of substances from the glomerular filtrate, made up of the proximal convoluted tubule, loop of Henle with its descending and ascending limbs, and the distal convoluted tubule. The collecting port begins as a junctional tubule from the distal convoluted tubule. Many tubules unite together to form the ducts of Bellini which open into the minor calyces through the renal papillary. Juxtaglomerular apparatus is formed at the vascular pole of glomerulus which is intimately related to its own ascending limb of the Henle's loop near the distal convoluted tubule. The apparatus consists of, a macula densa formed by altered cells of tubule. A. Juxtaglomerular cells, formed by the epithelioid cells in the media of the afferent arteriole. B. Sumagranular cells between macula densa and the glomerulus proper. Vascular segments. The renal artery gives 5 segmental, 4 from its anterior division and 1 from its posterior division, Fig 24.9, the segments are apical, upper, middle, and lower on anterior aspect. On posterior aspect segments seen are posterior and parts of apical and lower segments. Blood supply of kidney. The blood supply of kidney shown in flow chart show in Fig. Lymphatic drainage. The lymphatics of the kidney drain into the lateral aortic nodes located at the level of origin of the renal arteries, L2. Nerve supply. The kidney is supplied by the renal plexus, and of one shoot of the coeliac plexus. It contains sympathetic, T10L1 fibers which are chiefly vasomotor. The afferent nerves of the kidney belong to segments T10 to T12. Exposure of the kidney from behind. In exposing the kidney from behind, the following layers have to be reflected one by one, Fig 24.11. L. Skin. 2. Superfacial fascia. 2. Posterior layer of thoracolumbar fascia with latissimus dorsi and serratus posterior inferior. 3. Erector spinae which can be removed for convenience. 4. Middle layer of thoracolumbar fascia. 5. Quadratus lumborum. 6. Anterior layer of thoracolumbar fascia in which the related nerves are embedded. Histology. The cortex of kidney shows cut sections of glomeruli, many sections O1 proximal convoluted tubule, some sections of distal convoluted tubule and few collecting ducts. Section through the pyramid of the medulla shows light staining collecting ducts, sections of loop of Henle, thick and thin segments of descending and ascending limbs, capillaries, and connective tissue. In surgical exposures of the kidney, when sometimes the 12th rib is resected for easier delivery of the kidney, danger of opening the pleural curity must be borne in mind. The lower border of the pleura lies in front of the 12th rib and behind the diaphragm. The order of structures from anterior to posterior side being diaphragm, pleura, and rib. When the 12th rib is absent or is too short to be felt, the 11th rib may be mistaken for the 12th, and the chances of opening the pleural cavity are greatly increased. Lithotripsy has replaced conventional method to some degree. The angle between the lower border of the 12th rib and the outer border of the erector spinae is known as the renal angle. It overlays the lower part of the kidney. Tenderness in the kidney is elicited by applying pressure over this angle, with the thumb. Blood from a ruptured kidney or pus in a paranephric abscess first distends the renal fascia, then forces its way within the renal fascia downwards into the pelvis. It cannot cross to opposite side because of the facial septum and midline attachment O1 the renal fascia. Kidney is palpated bimanually, with one hand placed in front and the other hand behind the flank. When enlarged, the lower pole of kidney becomes palpable on deep inspiration. A floating kidney can move up and down within the renal fascia, but not from side to side. In such condition the posterior layer of renal fascia can be sutured with diaphragm and kidney can be fixed in position. The common diseases of kidney are nephritis, pyelonephritis, tuberculosis of kidney, renal stones, and tumors. Common manifestations of a kidney disease are renal edema and hypertension. Raised blood urea indicates suppressed kidney function and renal failure. Kidney transplantation can be done in selected cases, Figs 24.16a and b. One common congenital condition of kidney is polycystic kidney which leads to hypertension. In cases of chronic renal failure dialysis needs to be done. It can be done as peritoneal dialysis or hemodialysis. The kidneys are likely to be injured due to penetrating injuries to lower thoracic cage. These may also be injured by kicks in the renal angle between the vertebral column and 12th rib. Kidney is likely to have stones as urine gets concentrated here. Kidney stone lies on the body of vertebra. Gallstones lie anterior to body of vertebra. Ureters. The ureters are a pair of narrow, thick-walled muscular tubes which convey urine from the kidneys to the urinary bladder, Fig 24.21. They lie deep to the peritoneum, closely applied to the posterior abdominal wall in the upper part, and to the lateral pelvic wall in the lower part. Dimensions. Each ureter is about 25 centimeters, 10 inches, long, of which the upper hall, 5 inches, lies in the abdomen, and the lower half, 5 inches, in the pelvis. It measures about 3 millimeters in diameter, but it is slightly constricted at 5 places. Course. The ureter begins within the renal sinus as a funnel-shaped dilatation, called the rens pelvis. The pelvis issues from the hilus of the kidney, descends along its medial margin, or partly behind it. Gradually it narrows till the lower end of the kidney where it becomes the ureter proper. The ureter passes downwards and slightly medially on the tips of transverse processes and the psoas major muscle, and enters the pelvis by crossing in front of the termination of the common iliac artery. In the lesser or true pelvis the ureter at first runs downwards, and slightly backwards and laterally, following the anterior margin of the greater sciatic notch. Opposite the ischial spine it turns forwards and medially to reach the base of the urinary bladder. Normal constrictions. The ureter is slightly constricted at 5 places. 1. At the pelvi-ureteric junction. 2. At the brim of the lesser pelvis. 3. Point of crossing of ureter by ductus deferens or broad ligament of uterus. 4. During its oblique passage through the bladder wall. 5. At its opening in lateral angle of trigone. Relations per my pelvis. In the renal sinus, branches of renal vessels lie both in front and behind it. Outside the kidney anteriorly. On the right side, there are the renal vessels and the second part of the duodenum. On the left side, there are the renal vessels, the pancreas, the peritoneum, and the jejunum. Posteriorly. Psoas major muscle. Abdominal port of ureter. Anteriorly, on the right side the ureter is related to, 1/3 part of the duodenum. 2. Peritoneum. 3. Right colic vessels. 4. Ileoiacolic vessels. 5. Gonadal vessels. 6. Tube of mesentery. 7. Terminal part of the ileum. On the fuside the ureter is related to 1. Peritoneum, 2. Gonadal artery, 3. Left colic vessels. 4 sigmoid: 5 sigmoid mesocolon. Posteriorly the ureter lies on 1. Pons major, 2. Tips of transverse processes, 3. Genitofemoral nerve. Medically, on the right side there is the inferior vena cava, on the left side, there is the left gonadal vein, and still further medially, the inferior mesenteric vein. Pelvic port of ureter. In its downward course the relations are, posteriorly, 1. Internal iliac artery, 2. Commencement of the anterior trunk of the internal iliac artery, 2. Internal iliac veins, 3. Lumbosacral trunk, 4. Sacroiliac joint. Late tally. 1. Fascia covering the obturator internus, 2. Superior vesical artery, 3. Obturator nerve. Fig 24.27, 4. Obturator artery, 5. Obturator vein, 6. Inferior vesical vein, 7. Middle rectal artery. 8. In the female, it forms the posterior boundary of the ovarian fossa. In its forward course, LN males. 1. Hiatus deferens crosses the ureter superiorly FRPM lateral to medial side. 1. Seminal vesicle lies below and behind the ureter. 2. Vesical veins surround the terminal part of ureter. In females, 1. The ureter lies in the extraperitoneal connective tissue in the lower and medial part of the broad ligament of the uterus. 2. Uterine artery lies first above and in front of the ureter for a distance of about 2.5 cm and then crosses it superiorly from lateral to medial side. 3. The ureter lies about 2 cm lateral to the esprovaginal portion of the cervix. It runs slightly above the lateral fornix of the vagina. 4. The terminal portion of the ureter lies anterior to the raging intravesical part. The intravesical oblique course of the ureter has a valvular action, and prevents regurgitation of urine from the bladder to the ureter. The ureteric openings lie about 5 cm apart in a distended bladder, and only 2.5 cm apart in an empty bladder. Blood supply. The ureter is supplied by 3 sets of long arteries. The upper part receives branches from the renal artery. It may also receive branches from the gonadal, or colic vessels. 1. The middle part receives branches from the aorta. It may also receive branches from the gonadal, or iliac vessels. The pelvic port is supplied by branches from the vesical, middle rectal, or uterine vessels. The artery to the ureter lie closely attached to peritoneum. They divide into ascending and descending branches which first form a plexus on the surface of the ureter, and then supply it. The upper and middle parts receive branches from medial side, while the pelvic part gets its arterial supply from lateral side nerve supply. The ureter is supplied by sympathetic from T10L1 segments and parasympathetic from S2-S4 nerves. They reach the ureter through the renal, aortic, and hypogastric plexuses. All the nerves appear to be sensory in function. Histology. Ureter is composed of 1. The innermost mucous membrane, 2. Middle layer of wall-developed smooth muscle layer, outer tunica adventitia. The epithelial lining is of transitional epithelium. Muscle coat in upper 2/3 has inner longitudinal and outer circular fibers. Lower 1/3 comprises an additional outer longitudinal layer. Connective tissue forms the outer layer. Development of kidney and urate. Kidney develops from metanephros, though pronephros and mesonephros appear to disappear. Only the duct of mesonephros, the mesonephric duct, persists. Thus the nephrons of the kidney arise from the metanephros. Parts of nephron formed are Bowman's capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule. Tuft of capillaries form the glomeruli. Collecting part of kidney develops from ureteric bud, which is an outgrowth of the mesonephric duct. Ureteric bud gets capped by the metanephric tissue. The ureteric bud forms ureter. Soon it dilates to form renal pelvis and divides and subdivides to form major and minor calyces and 1-3 million collecting tubules. Kidney starts developing in the sacral region, then it ascends to occupy its lumbar position. Anomalies of the kidney and ureter. 1. Non-union of the excretory and collecting parts of the kidney results in the formation of congenital polycystic kidney. 2. Fusion of the lower poles may occur, resulting in a horseshoe kidney. In these cases the ureters pass anterior to the isthmus of the kidney. 3. The early pelvic position of the kidney may persist. The renal artery then arises from the common iliac artery. 4. Unilateral opplosion or hypoplosia of the kidney may occur. Sometimes both kidneys may lie on any one side of the body. 5. The ureteric bud may divide into two, forming double ureter partly or completely. Ureteric colic. This term is used for severe pain due to a ureteric stone or calculus which causes spasm of the ureter. The pain starts in the loin and radiates down the groin, the scrotum, or the labium majus and the inner side of the thigh. Note that the pain is referred to the cutaneous areas innervat by segments, mainly T11 to L2, which also supply the ureter. Ureteric stone. A ureteric stone is liable to become impacted at one of the sites of normal constriction of the ureter, e.g. pelviureteric junction, brim of the pelvis and intravesical course. Duplex ureter. Two ureters drain renal pelvis on one side called as duplex system. Ectopic ureter. Single ureter and longer ureter insert more caudally and medially than normal one. Ureterocele cystic dilatation of lower end of ureter. Blood supply. Upper and middle parts of ureter are supplied by branches from its medial side. Pelvic part is supplied by branches from its lateral side. Mnemonics. Ureter to uterine artery, water under the bridge. The ureters, which carry water, are posterior to the uterine artery. A common surgical error could be to ligate and cut ureter with uterine artery while removing uterus. Structures at hilum of kidney. From anterior to posterior aspect VAUV renal vein. A renal artery. U pelvis of ureter. Order of structures at the hilum of kidney is renal vein, renal artery, and pelvis of ureter from before backwards. Kidney is kept in position by intra-abdominal pressure, pararenal, lat, renal fascia, perirenal fat, renal capsule. There are 5 renal segments. These are apical, upper, middle, lower, and posterior. Ureter shows 5 constrictions. These are at pelviureteric junction, at the brim of pelvis, at crossing with ductus deferens or broad ligament, intravesical course, and at its termination at the trigone of the urinary bladder. Most of the renal stones are radiopaque while most of the gall stones non-radiopaque. Excretory part of kidney develops from metanephros, collecting part of kidney develops from ureteric bud, arising from mesonephric duct. Ureter shows 5 constrictions. 1. These are at pelviureteric junction. 2. At the brim of pelvis. 3. At crossing with ductus deferens or broad ligament. 4. Intravesical course. 5. At its termination at the trigone of the urinary bladder. Most of the renal stones are radiopaque while most of the gall stones non-radiopaque. Excretory part of kidney develops from metanephros, collecting part of kidney develops from ureteric bud, arising from mesonephric duct.